Hello friends, welcome back. Now we are beginning with some short question answer which can be asked for 1 marks, 2 marks, MCQ or Viva question. So beginning with APGAR score. So what is the APGAR score? It is used to assess the health of newborn at 1 minute and 5 minutes. So we have criteria of appearance, pulse, grimace, activity, respiration, and the score is 0, 1, 2. So appearance, if the child is blue or pale, the score is 0. Body pink, extremities blue, the score is 1. Completely pink, the score is 2. Next, pulse. Pulse absent 0, less than 101, more than 102. Grimace, there is no response means 0. Grimace is 1, cry is 2. Activity, flaccid is 0, some flexion is 1, active movements is 2. And respiration absent is 0, slow or irregular is 1, and good or strong cry is 2. Okay, so this is not respiratory rate but respiratory effort. So overall the maximum score can be 10 and minimum can be 0. So if it is 7 to 10 it is normal, 4 to 6 it is moderate asphyxia, and 0 to 3 it is severe asphyxia. Okay, this was all about the APGAR score. Next is 5 C's for safe delivery. So what are the 5 C's? First is clean hands, hand hygiene before delivery. Next is clean perineum, clean the perineal area. Then is clean delivery surface, use clean, dry and covered surface. Clean cord care, use sterile blade and tie cord with sterile thread. Clean practices, avoid unnecessary vaginal exam. Okay, so what are the 5 C's? First is clean hands, clean surface, clean perineum, clean cord care, clean practices. Then for a more precise answer, if you look through the WHO guidelines, the first clean is clean hands, then next is the clean surface, clean cord tie and clean cut and wrapping. Okay, the clean hands, clean surface, clean cut, clean cord and clean cord tie. The next is cold chain. So what is cold chain? It is a system of storing and transporting vaccines within temperature range of +2 to +8 degree Celsius to maintain their potency. The components of cold chain are ice-line refrigerator maintained at this temperature, deep freezer -15 to -25 degrees Celsius, vaccine carrier, cold box, ice packs, thermometer, data logger in some places. Okay, next is reverse cold chain. Reverse cold chain means system of returning unused vaccines, open vials and contaminated materials from periphery to higher centers for proper disposal. Purpose is to prevent immunization errors, ensure safe disposal, prevents reuse of discarded vaccines, maintains quality control. We also know we use reverse cold chain for stool sample during AFP, acute flaccid paralysis, surveillance. Okay. Next is open valve policy. Open valve policy means once a multi-dose vial is opened, it can be used for the rest of the session under the following condition: that vial label is intact, vaccine has not expired, it is stored between +2 to +8, aseptic technique is used and VVM is not discarded. And then you discard at the end of the session. Okay, so commonly the question can be asked: open vial policy is followed by which vaccines and not followed by which vaccines? Okay, so these are the vaccines which follow open vial policy, so they can be released in 28 days of its open vial. TD, OPV, DPT, Hep B, Penta, IPV, PCV. The vaccines which do not follow open vial policy should be used only till 4 hours from the opening. It includes measles, rubella, BCG, Japanese encephalitis, and rota. Next is full immunization versus complete immunization. So full immunization is as per age by which child receives all vaccines. Example, all vaccines by 1 year of age. Time bound. So there is an age 1 year and the child has received all vaccines up to 1 year. Complete immunization is as per vaccines by which child receives all vaccines. Examples, all vaccines till 16 to 24 months. So whatever is the age of child, but 16 to 24 months, up to that duration of time, whatever vaccines has to be given, the child has received. So this is vaccine. Okay. Next is GE vaccine schedule. So 2 doses of live attenuated SA 14-14-2 given 28 days apart. Age 1 to 15 years in endemic areas. Booster dose after 1 year in high risk areas. Route is subcutaneous route. There is another vaccine Genvac which we give annually. The site is upper arm. Okay, so this is the GE vaccine schedule. Now coming to diphtheria vaccine schedule. So it is as a part of DPT or pentavalent vaccine. So there are primary 3 doses at 6, 10, 14 weeks. Then booster 1 at 16 to 24 months, booster 2 at 5 to 6 years and booster 3 at 10 years. Okay, 1 is DPT, 2 is DT, 3 is TD. Route is IM, intramuscular. Anterolateral aspect of thigh in infants or upper arm in older child. Then next comes OPV schedule, dose and route. So birth dose is within 15 days of birth. Routine at 6, 10, 14 weeks. Boosters at 16 to 24 months and 5 years under the pulse polio programs. Doses 2 drops, 0.1 ml. 2 बूंद जिंदगी. Route is oral, site is by mouth. Next comes the vitamin A schedule. First dose is at 9 months, 1 lakh international unit. Second dose is at 16 to 18 months, 2 lakh international unit. And subsequent doses is 2 lakh international unit every 6 months up to the age of 5 years. So there are total 11 doses in total. So the route is oral, site is by mouth. Now coming to ASHA work profile. So ASHA is accredited social healthcare activist. Now what are the works that ASHA has to do? Act as a link between community and health system, mobilize community for health services, promote institutional delivery, ensure immunization and growth monitoring, provide health education and counselling, identify and refer sick persons, maintain record and report, facilitate family planning services. Okay. Then CHO work profile, community health officer. Provide comprehensive primary health care, manage NCDs, RTIs, diarrhea, fever, etc. Provides family planning services, conduct basic lab tests, promote health and sanitation, maintain register and reporting, ensure referrals, teleconsultation and community mobilization. Coming to multi-purpose worker male work profile. So he has to supervise health services and sub-center, assist in MCH immunization and family planning, conduct home visits, maintain records and reports, health education and counseling, ensure sanitation and vector control, assist ANM in clinics. Next is what is palliative care. So it is an approach that improves quality of life of patients and their families facing problems associated with life-threatening illness. So what comes under it? It is to relieve pain and other symptoms, provide psychological, social and spiritual support, can be provided at any stage of illness, not only terminal. It's a team approach, focus on care, not cure. Okay. Now coming to snake bite. Snake bite first aid. So reassure the patient, not all snakes are uh, venomous. Keep patient calm and at rest. Immobilize the bitten limb. Remove tight clothes, rings, bangles or anything. Do not cut, suck or apply tourniquet. Shift to nearest health facilities. Anti-venom as per indication and tetanus prophylaxis. So this is only about the first aid. What are we supposed to do exactly in snake bite management? We'll learn further. Next is dog bite first aid. So you have to wash the wound immediately with soap and running water for 15 to 20 minutes. Apply antiseptic solution. Do not apply irritants. You have to categorize the bite under 1, 2, 3 WHO categories. Give ARV, anti-rabies vaccine as per indication. Give tetanus toxoid, antibiotics if required. Okay. And immunoglobulin also only if required. This also is a detailed answer, but it's only talking about the first aid, so you can write this much. Next is scabies. Scabies is caused by Sarcoptes scabies, which is a mite. It will cause intense itching, which is more at night. Common sites are finger webs, wrist, axillae, waist, buttocks, genitalia. This is the circle of Hebra, which is affected. Treatment is permethrin 5% cream. Below the neck we have to apply. Treat all family members. Wash clothes, bed linen in hot water. So if scabies is asked, this is the overall point you can write. Whole scabies is covered beautifully in this. Now next is air pollution indicators. So what are the indicators of air pollution? So there are gases like sulfur dioxide, nitrogen dioxide, carbon monoxide, particulate matter 10, particulate matter 2.5, lead and ozone. What are the water pollution indicators? We can measure pH of water, turbidity, dissolved oxygen, biological oxygen demand, nitrate, coliform count and total dissolved solids. Next is thermal indices. So in thermal indices we have dry bulb temperature, wet bulb temperature, relative humidity, wind speed, heat index, humidex, WBGT index, effective temperature. Talking about the contraceptive methods, this is again a very long answer, but if you just have to enumerate, you know there are two, temporary and permanent. Under temporary we have natural methods like coitus interruptus, calendar method, barrier methods, then IUCD, hormonal methods, emergency contraception and permanent methods. So first here they are talking about barrier method. So what is the barrier method doing? It is preventing the sperm from reaching the ovum. Male condoms are most commonly used. Female condoms are pessaries, diaphragm, cervical caps, spermicidal agents like foams, jellies, creams. Safe, easy, no systemic side effects, and the most common advantage is that it also prevents STI. Okay. Next coming to copper T. Copper T, non-hormonal IUCD, copper excess spermicidal, effective for 5 to 10 years, can be used in lactating women. Side effects are pain and bleeding. Contraindications in pelvic inflammatory disease, pregnancy, unexplained bleeding. Okay, this was about copper T. Depot medroxyprogesterone acetate. It is an injectable contraceptive. Doses 150 mg intramuscular. Interval is every 3 months. It is highly effective, but the side effects are irregular bleeding, weight gain, delay in return to fertility. Then next is terminal contraceptive methods. So terminal contraceptive methods include for female tubectomy and for male vasectomy. In tubectomy, cut and tie the fallopian tubes. It is done under local general anesthesia. Permanent method. And vasectomy is cut and tie the vas deferens. Simple, safe OPD procedure, permanent method of sterilization. Okay, so these were some short question answers that we have covered. Coming to one more, it is the basics of counseling. So counseling is a two-way process of communication between a health worker and an individual or clients to help them understand their problem and accept advice and services for voluntary action. Okay, so principle of counseling, there is a gather approach. That is, greet the client, welcome the client warmly and create a friendly atmosphere. Then ask open-ended questions, allow the client to express freely. Then tell or give information, correct, relevant and adequate. Help the client to understand. Ensure the client has understood the information you have given. Encourage appropriate decisions. Help the client to take the right decisions. Refer for further care. Refer to appropriate services if needed. So what is the gather approach? If we summarize it, the gather approach is first greet the client, ask, tell, help the client to understand, encourage appropriate decision, refer for further care. What are the steps? First is preparation. Know yourself, the client and the setting. Arrange privacy and ensure no interruption. Then step 2 is rapport building. Establish an rapport. Step 3 is assess the needs. What are the client's problems, needs and concerns. Then provide information. Help in decision making. Discuss the options and help client choose the best option. And 6 is close the session. Summarize and then plan for follow-up. Okay, so these are the 6 steps or process of counseling. So these are the qualities of a good counselor. Do's and don'ts. Type of counseling by approach. Directive counseling, counselor gives advice and guidance. Non-directive is counselor helps the client to express and decide. Supportive counseling is counselor gives emotional support and encouragement. Behavior change counseling is it focuses on changing unhealthy behavior. Okay, keyword is gather. Greet, ask, tell, help, encourage, refer. Okay, this was all about the basics of counseling. So we are done with the short answers here. We'll go for a bit brief or long answers in the next video. Thank you.